Good evening, good morning, good afternoon, wherever you may be located. YouTube, today I wanted to talk to you about Obamacare. And this is going to be a, let's say, pretty good, informative, long video. If you're interested in hearing my opinions about Obamacare from an unbiased point of view, welcome. If you don't like to hear the opinions of others, especially from an unbiased perspective, please exit now. Now, let's begin by finding out the purpose or the main factor onto as why this reform was created, how it took place, how it is informed, the repercussions, the benefits, the pros and cons. A lot of Americans are kind of making their minds up by now, saying that Obamacare or the healthcare reform is indeed a socialist approach towards the government aspect of controlling the healthcare. The controlling of healthcare by the government, this isn't really what you should be worried about. Let's discuss a little bit and get right into it. Obamacare is not by any means any step towards socialism. Why I say that is because if we understand who benefits from this healthcare reform, we get a light bulb effect. Ding! Oh, this is a pure capitalistic approach to healthcare. By making all individuals have some sort of healthcare insurance, having to purchase a premium from a private organization that deals and carries insurance benefits to its subscriber. You're being made, that means you are literally forced to purchase a premium or to purchase an insurance for health care without having the choice to opt out. This is a pure capitalistic approach. And from my unbiased perspective, I dare say that I come from a communist country myself. I am not a communist. I come from a communist country where the Castro regime is still active in Cuba. And healthcare there is, as many would say, socialist or communist healthcare. The reason why the communist regime is able to afford that is because they control the doctors, they control the treatment, they control the medication, the pharmacists. The government controls every aspect of healthcare, including how doctors are paid. Government pays the doctors. It's like if everyone was on Medicaid or Medicare. The only difference is that instead of the citizens paying into a system of Social Security or a federal account for the federal government to use for healthcare or healthcare services, instead it is the government pays the provider or the physician or whoever's treating the patient directly, and they pay them a waged salary, which means a set amount of money per month, regardless of how many patients you see, because it is a communist country and the structure of the economy is based on communism. Socialism, on the other hand, and believing that Obamacare is a socialist approach to healthcare, is false. It is a capitalistic approach. Now, I'm not saying that Obamacare is bad or good, because it could be both. From my own biased perspective, it's both good and bad. Am I leaning towards either good or bad? I'm going to stay right in the middle, because even though it affects me, there's nothing really I can do except hope for a conservative president or a Republican to either tweak it or remove it. But from my own biased perspective, in the middle of between, I'm going to say that Obamacare, like I've said previously, is a capitalistic approach to the healthcare reform. I think the only reason why the conservatives or the Republicans, the right wing, doesn't like it is because the left wing pushed it and got it through. Though it is horrible, it still got through. I think a conservative could probably implement different changes to it and improve it. My perspective, again. So, now we're talking about everyone having healthcare insurance, whether it is from a private carrier or a federal funded insurance. You must be insured. One thing that I didn't mention is that healthcare is one of the fields and one of the industries that will always be busy in every aspect. It will always have jobs because people need or have the need for health. Therefore, it is a field that will never be out of demand, or it is not a field that could ever be outsourced. Therefore, it is a profitable field, and if it is a profitable field, the government, especially in this country at this point in time, needs to benefit from it. Obama was smart by, tapping into that industry and making it fill in the federal budget. This could be a very, very, very good thing for the deficit, which there's nothing wrong with that. We need it. But forcing your people to purchase something and that they have no option. What if you don't want to be insured? Well, in the right logical mind, you would be like, why wouldn't you want to be insured? Well, some people have different ways to deal with their healthcare needs. A lot of immigrants, they become ill, they go back to their country, their, you can say, motherland, and they get their healthcare needs met there. Then they return to the States, they're healthy. Other people may apply for federal funded insurance to help their healthcare needs, to meet their healthcare needs. Other people believe that they're healthy and that they don't need healthcare. They don't need insurance. And if something was to happen, they could, out of pocket. That's when your emergency funding or your emergency saving account plays its role. But the only thing that I find incredibly oppressing is that you are making it a mandate and that you are telling people that they must have it. That I do not like. You as a government do not have, I'll repeat this again, you do not have the right to manage the health of people by making them make uninformed decisions about how they should be caring for their health. You can advise, but you cannot make people do what they can't do against their own will. And especially young adults are the ones who are paying the consequences. I'm going to end this video now, And my conclusion is, computer screen just turned black. I'm talking too much. Anyways, coming back. My conclusion of this whole issue is, the way it stands and the way it is, I do not like it. I really don't. This is my opinion. My opinion is something that I have generated through research and through study. Unless further study or further research is given to me, or something is done to that specific reform, my opinion stands. It needs to be improved or changed. The way it is not. It is far from being good. Far from being good. The deductibles are huge. Fuck me. So you end up paying thousands of dollars for one specific procedure out of pocket before even your insurance deems it necessary, or not deems it necessary, deems that is within the policy for them to even pay for it. Okay. Goodbye.